Okay, hello. My name is Brooke Mills, and I am a clinical psychologist. I work in an inpatient mental health clinic, oftentimes helping teenagers from 13 to 18 years of age, all the way up to adults around 40 years of age. The clinic I work for handles all kinds of mental health disorders, from anxiety disorder, depression, bipolar disorder, and even schizophrenia. I came here today to share the importance of bipolar disorder and be able to give it more recognition. In my current healthcare setting, we see anywhere from 30 to 50 people come in each year suffering from symptoms of bipolar disorder. Bipolar disorder is a mental disorder that affects the way people are able to live their normal lives. They can be constantly switching from really high energy that puts them in a good mood, makes them hyperactive and loud, and even can cause delusional thinking, to a really low energy that shows signs of depression, suicidal thoughts, insomnia, fatigue, and even loss of appetite. Oftentimes, when patients are admitted to our clinic, we are able to help them be consistent with their medication, or we will prescribe the medication after a lot of testing is done. But even with medication, they still seem to be experiencing high and low periods throughout the week. If our patients have previously been on medication and have been diagnosed professionally with bipolar disorder, their treatment can last a few weeks to maybe 2 months until their medication and energy periods have been more consistent and under control. If they have never been previously diagnosed and we are the ones to diagnose them, then they typically stay with us up to 6 months or even longer. Now I want to talk about a patient who was recently admitted into our clinic a few months ago. For legal and privacy reasons, I have removed his name from the presentation. My patient is a 17-year-old African American male whose family does not have a lot of money to help support his bipolar disorder on a regular basis. He was previously diagnosed with bipolar disorder by the age of 13 and has been on and off medication since then. Since there is an issue with money, I have tried to recommend other treatment plans to help through his high and low moods, but the people in his life can't always be there for him. I bring up this issue because I would like other healthcare professionals to help with recognizing and spreading awareness for bipolar disorder and for the people who struggle to get the care they deserve due to financial or other issues. Medication plays a huge role in helping people with this disorder, but so can the spread of awareness. Bipolar disorder is not talked about enough in communities, especially for males with this disorder. I would love to have more open and honest conversations about it and find other ways to manage it without the use of medication when the patient is unable to access it. Thank you.